country is changing before our very eyes. People queuing in the sunshine just to get into supermarkets. Many shelves empty when they get there. Government and retailers trying to calm nervous shoppers.
There is more than enough food to go round, and our food supply chain is able to expand production to cope with increased demand. In the last week, sales of some foods have increased significantly, and manufacturers have produced around 50% more food than they usually would.
There is £1 billion more food in people's houses than there was 3 weeks ago, so we should make sure we eat some of it and be considerate, and also think about other people right across your communities.
That includes NHS staff. Medics angered at stories of some of them being unable to buy food for their families.
Frankly, we should all be ashamed that that has to happen. It's unacceptable. These are the very people that we will all need to look after perhaps us or our loved ones in the weeks ahead.
NHS staff are at high risk of catching the virus. Today it emerged that 2 ear, nose and throat specialists had been admitted to intensive care.
We are very concerned that 30 to 40% of patients with COVID-19 are totally asymptomatic. That is, they appear perfectly normal, and as a result of that, our colleagues have become infected.
But this afternoon, NHS England announced an unprecedented deal with private medical providers to bring in more staff and resources, including 8,000 beds, 10,000 nurses and 700 doctors. And today, new guidelines for doctors were rapidly published, advising them to base decisions on COVID-19 patients' admission to critical care on the likelihood of their recovery. They are the kind of difficult decisions medics already have to make, but soon they will be making a great many more of them.